Hi, I'm Dr. Larry Malerba, and welcome to the ATH Materia Medica series. In this first episode, I've chosen to discuss Stramonium, mainly because it's such a valuable and commonly indicated remedy, and I've seen it work so well for so many patients. It's an indispensable remedy. Now, Materia Medica can be a tricky thing. Sometimes we can get very different impressions of the same remedy from studying different sources. Some of the older Materia Medicas can make one think that Stramonium is suited only for extreme psychiatric pathology. Listen to this brief description of the mental symptoms from one source. Quote, does all sorts of crazy things, raving mania and cold sweat, religious insanity, self-accusation, talks in foreign tongue, fear and anxiety on hearing water run, aversion to all fluids, mania, curses, tears his clothes with teeth, violent speech, exposes himself, wants to kill people or himself, unquote. Now, it's true that Stramonium could work miracles if it was properly prescribed by a qualified homeopath in a psychiatric setting. But it's important to understand that Stramonium can also be very helpful in garden variety, run-of-the-mill cases, like a kid who's afraid of the dark, or a young girl who refuses to learn how to swim, or for a little boy who has a habit of biting his sister. Stramonium is an everyday remedy that can be successfully used in everyday cases. In the following presentation, I'll summarize some of the more common keynotes, symptoms, and characteristics of homeopathic Stramonium. Okay, so the first remedy I'll be discussing in the Materia Medica series is Stramonium, also known as the common thorn apple. The scientific name is Datura stramonium, which is the genus and species of the plant. In the days of the early settlers of America, it was known as Jamestown weed, and it later came to be known as Jimson weed. There have been periodic reports over the years of kids trying to smoke Jimson weed to get a cheap high. And as we discuss the pathology of this plant and this remedy, it'll become clear that this is the last thing you want to try and get a cheap high from. The plant is from the nightshade family, the Solanaceae family. And the interesting thing about it is that the flowers open up at night. They close during the day, and then they bloom or open up at night. And this is a metaphor for the action of the substance of the plant and some of the pathology associated with it. It's part of you could consider it the doctrine of signatures, whereby the form is an indication of the function of the plant. Now, there's a very strong theme that runs throughout Stramonium, and that is fear and aggression. And oftentimes in cases, we'll see both fear and aggression being expressed in the person who needs this remedy. Sometimes we'll see one or the other, where you can have mostly just fear or mostly just aggression. But a lot of times there's fear and violence combined. The fear part tends to be the stronger part, the more common feature that will lead you to a prescription of Stramonium. In most Stramonium cases, the level of fear is often dramatic and striking. The most prominent and most common fears tend to be fear of the dark, fear of being alone, fear of violence, fear of animals, and fear of water. Fear of the dark is especially prominent, and it often occurs when the person is alone in the dark at night. So there's fear of being alone at night in the dark, and you'll see this oftentimes with children, where there are elaborate bedtime rituals where the parents do everything they can to try to get their child to go to sleep. There'll be a nightlight in the room. The parent will often lay down in the same bed and wait till the child is asleep and then try to sneak out of the room. And sometimes that will be accomplished. And even then, oftentimes the child will wake up in the middle of the night and run to the parent's room and sleep in the parent's bed. Some of these kids just won't sleep alone in their own room at all. Sometimes they will sleep if they have a sibling in the room and a nightlight, and a lot of times they just won't tolerate being alone or away from the parents at night. There's also fear of violence in all shapes and forms, fear of any kind of danger, fear of being attacked, fear of being murdered, injured, fear of a violent death. You'll see adults who are afraid of terrorists. Children are often afraid of scary TV shows, scary movies, as are adults too, if you ask them. Kids will sometimes be afraid of clowns or Halloween costumes, and a lot of these children who need stramonium can have nightmares and night terrors. We'll also see fear of animals, especially dogs, but any potentially aggressive or dangerous animal like bears or wolves. You'd be surprised if you ask a little kid, a 2-year-old or a 3-year-old, what they're afraid of, and they'll say things like dinosaurs and sharks. And I remember one child said to me, animals with big teeth. Now, parents will sometimes dismiss these fears as just a vivid imagination, but the things the kids say are not coincidental, and you have to trust what the kids are saying, and those are often very useful clues. Alternately, sometimes you'll see people who are both fascinated with violence and afraid of it. So they'll see some teenagers will admit they're into horror movies, but they're also terrified and afraid of being attacked or afraid of the dark or some combination like that. All of these fears add up, and they demonstrate the importance of limiting children's exposure to all sorts of violence, because young minds are impressionable and can be easily scared, and young children often cannot differentiate between fantasy violence and reality. So it's very important not to expose kids to the level of violence that is prominent, especially in American culture. There's also a fear of water, and that often takes the form, in children at least, of afraid of even getting water on their heads, like when they're bathing or in a shower, they refuse to get water on their head or on their face, or if they'll go in a swimming pool at all, they won't want to put their heads under the water. And adults who are afraid to swim or who have never learned how to swim, you have to suspect that there's this fear of water. There's also a fear of tunnels and claustrophobia, and similar to water, all those fears are connected by the fact that they involve the suffocation as the method of death, right? So if I'm claustrophobic or in a tunnel, I could suffocate, or if I'm underwater, I can suffocate. And that seems to be the fear that ties those together. So in review, the main prominent fears with stramonium that you tend to see are fear of the dark, fear of being alone, violence, animals, and water. Okay, so on the flip side of the stramonium fear factor, we tend to see aggression. There's an intensity, an impulsivity, an excitability, often to the point of violence. The person may be explosive. There may be sudden outbursts, outbursts of anger, outbursts of rage. We may see the person go from 0 to 60 almost involuntarily. Now compare this to the willfulness of tuberculinum. A tuberculinum child may throw a prolonged temper tantrum, but that would be an act of will, whereas stramonium almost involuntarily reacts in anger or rage. There may be screaming and shrieking. Sometimes they'll threaten, and certainly children can bite. They'll be hitting and striking and sometimes swearing. Sometimes this violence can be directed inward toward the person himself or herself. You may see suicidal behavior. Sometimes you'll see no aggression at all, and instead the person may present as timid or introverted. And this can be interpreted as sort of an expression of the fearful side. So rarely will you see someone who's well balanced in the middle. Instead, you'll see someone who's timid or someone who tends to be aggressive, or even a mix of the two. You can have someone who is timid who also has a tendency towards explosive anger. So stramonium involves this mix of both fear and aggression. Another common feature of stramonium is hyperactivity. These patients can be restless, overly active, even agitated. Children can be wild. They can be loud and talkative, or as the homeopathic books say, loquacious. Oftentimes, these patients come to the homeopath with a diagnosis of ADD, or attention deficit hyperactivity disorder. Lots of PTSD cases, post-traumatic stress disorder, will respond well to stramonium, especially if those cases involve exposure to violence. The underlying state of stramonium is one of fight or flight. It's as if the original threat is still present, and the person is always on the alert, hypervigilant, ready to spring into action, ready to fight or ready to flee. If you think about it, when faced with danger, you have two fundamental options. One is to run for your life, or the other is to stay and fight. And it's as if these patients are permanently in this state of alert, ready to fight or to flee. I remember a patient once telling me about this fantasy he had where he would be in a restaurant with his family and he would imagine a gunman entering the restaurant, and he would think about what he would do. He'd grab his children, he'd put them under the table, he'd dive under the table, he'd charge the gunman, he'd do all these things in order to protect his family. So his mind was in this state of fight or flight, and stramonium was a good remedy for him. Now, around the age of 2, the mind starts to become more aware, but it's often unable to discern the difference between fantasy and reality. So kids at this age are particularly vulnerable to exposure to violence, and they can be very easily frightened. Stramonium is a common remedy for young boys, but I've also seen it work more than a few times for girls too. Stramonium can also be indicated in a variety of additional psychiatric disorders, including obsessive compulsive disorder, mania, paranoia, and even schizophrenia. Now, stramonium is also associated with a large variety of neurologic problems. Stuttering is particularly common, especially when the person struggles at the beginning of a word. There may be tics and a wide range of involuntary movements, like head jerking, eye blinking, chorea, and Tourette's. Stramonium can help strabismus, which is a condition whereby the eye muscles pull the eye out of proper alignment. This can result in a cross-eyed appearance or sometimes double vision. There may be muscle twitches and muscle spasms, even febrile seizures or seizure disorders. I once treated an infant who was having up to 20 seizures per day. Conventional anticonvulsant medication wasn't helping. One dose of stramonium and the child never had a seizure again. When we see a combination of red face, dilated pupils, and twitching, we think of stramonium. This could be seen in fevers, seizures, mania, or even sunstroke. Stramonium is also a remedy for meningitis and even for rabies. Now, most of the clues leading to a stramonium prescription are going to be psychological and behavioral in nature, but there are some additional clues that can be helpful. Recall the fact that stramonium flowers at night, and how I said that this was an example of the doctrine of signatures. Most stramonium pathology is either made worse by or comes out at night, just like the flower of the plant. Stramonium symptoms are typically worse at night or worse in the dark, and conversely, they're better in the daytime and better in the light. Now, the etiology or causative factor for stramonium pathology is often a frightening event or having experienced physical or psychological abuse. In addition, neurologic insults like fever or head trauma can induce a stramonium state. Generally speaking, the deeper the psychological pathology, the less useful the physicals and generals become. Clues that point towards stramonium are heavily skewed toward the psychological. Nevertheless, there are a few reliable physical clues that may help confirm stramonium. They tend to be warm-blooded. They desire sweets. My own observation is that there can be a pink tinge to the entire face. Now compare this to the bright red face of belladonna, which is quite different. The stramonium face, at least in some cases, can be pink all over, and it's like a steady state. It's not like it flushes deeper or less like with a belladonna. We also see left hip pain that can be a specific symptom for stramonium. And even though most of the clues are psychological, if the rest of the case fits, stramonium can solve all sorts of physical problems, like ear infections, headaches, coughs, and even asthma. Important remedies to compare to stramonium include hyoscyamus, which can have rage and similar fears, but the underlying state in hyoscyamus is jealousy or a desire for attention. Belladonna has similar fears and can also be explosive. However, it's usually not a fear-based remedy. I also recommend that you study and compare aconite and opium with stramonium. While it's true that a lot more can be said about stramonium, I wanted to summarize the most important features for you here. I plan to create a lot more Materia Medica episodes, but please be patient because they do take some time to produce. In the meanwhile, be sure to subscribe to the ATH channel and don't forget to tell your friends about All Things Homeopathy.